Hi guys, my name is Khrystyna and this is Corynne and Jazmin, and we are going to talk about the parathyroid gland today.
Hi. So there are 4 parathyroid glands and they are located in the neck, posterior of the thyroid gland. These glands are approximately the size of a grain of rice. Now, these may be very small, but they are super important. In fact, they are so important that there are 4 of them, just in case one of them goes wrong.
Like Jazmin was saying, the parathyroid glands are very important to us, and the reason that they are so important is because they're regulating the levels of calcium in our body. Now, it's kind of easy to think about this, how this works, if you think about the heaters in your house. So in the winter it gets cold and we turn on our heat. Now, our thermostats can sense what the temperature is in the house, and so if it gets too cold, our thermostats tell the heater, go ahead and pump some heat into the home and release the heat to heat it up. So that happens. But then when the temperature starts to rise in the house and gets a little warm, then the thermostat recognizes that and says, well, we don't want it too hot, so it signals the heater to stop releasing the heat, and so our homes stay pretty decent. And that's kind of how the parathyroid hormone is working. So when the calcium levels are low in our body, our parathyroid gland has these receptors on them. And those receptors are sensing the levels of calcium. So when it's low, the receptors are telling the gland to go ahead and release parathyroid hormone. And so it does that, and those hormones are going to do a couple of things. And one of those things they're going to do is they're going to go over to the bone, and they're going to access some of that stored calcium in the bone, because the bone is storing up tons of calcium and it lets our blood borrow it when it needs it. So that's pretty cool. So then the bone is going to release some of that calcium into the blood, and that's going to raise our levels. So that makes us happy. Another thing that's going to happen is we're going to have some extra calcium absorbed from our GI tract, so that's going to increase. And there's also some vitamin D that's going to help play a role in our calcium absorption. And so we have these different outlets that are raising our calcium levels in our blood. So now things are getting better and our receptors are sensing, okay, so we have some calcium in the blood, we're having a good amount, and so what's going to happen is our parathyroid hormone is going to stop producing the parathyroid hormone because we don't want to have too much calcium in our blood. Okay, and so it stops and we're happy with our great range. And so this cycle continues to happen over and over in our bodies 24 hours a day, 7 days a week. So those parathyroid glands are pretty hard working. And it's keeping us in a very narrow range of calcium levels from about 9 to 10. And that's how our parathyroid gland works.
So, I don't know, Jazmin, do we really need calcium? Do we? Do you like walking? Do you like your muscles moving? Do you like your nervous system communicating?
I think so.
Yeah? Then we really do need it. So, Jazmin, what are some problems that can happen with our parathyroid glands?
I don't know. What are they?
We can have hyper and hypo. In this picture, we see a thyroid with 4 parathyroid glands on it. The enlarged gland is our hyperparathyroid. Hyperparathyroidism occurs when the parathyroid glands makes too much PTH. PTH helps regulate the level of calcium, vitamin D, and phosphorus in our bones and blood. Some people with this condition don't experience any symptoms at all, while others might need surgery. There are 3 types of hyperparathyroidism. Primary occurs when you have a benign tumor and at least one of your glands causing oversecretion of PTH. Secondary is when you have a problem with vitamin D deficiency, malabsorption, and chronic kidney disease or hyperphosphatemia. So get this. A person has a chronic kidney failure, they're on dialysis. Because of this, their parathyroid gland is functioning abnormally. After receiving a kidney transplant, the malfunctioning parathyroid can damage the new kidney. This would be your tertiary reason. So these are the different types of parathyroidism. Oh, hey, Chris. How are you? Sorry, I'm late.
It's okay, Chris. How was your weekend?
Good. How's your night?
It was long. I'm ready to go. Are you ready?
I'm ready.
Okay, so yesterday we had a patient, 4-year-old female, come into the ER. She was complaining of back pain and dysuria. So the doctor went ahead and ordered her labs and a CT scan. She was also very irritable upon admission as well. So her scans revealed that she has kidney stones, and her labs revealed that she has an elevated calcium. She also has a history of some elevated calciums in the past.
Mm-hmm.
So the doctor went ahead and ordered a ultrasound, and the ultrasound revealed that there is an overactive parathyroid.
Oh, didn't he? I think you would also order a bone density, right?
Yes, absolutely. Sorry. So the bone density was also ordered, and that was showing signs of hyperparathyroidism. So they went ahead and scheduled her for a parathyroidectomy,
Mm-hmm.
which she went down for this morning, and she is now recovering. Upon removing one of the parathyroid glands, they noticed there was a second one that was overactive, so they took them both out. And so now the patient is stable. She has been, however, experiencing mild tetany, and it seems like it's getting a little more increased. It seems like maybe it's getting more severe.
Mm-hmm.
So the doctor has ordered IV calcium.
So and then we infuse that very slowly, right?
Mm-hmm.
We don't want to go too fast.
Exactly.
All right, perfect.
And check the site.
Oh, good call, good call.
Okay.
All right, so I'll just continue monitoring the patient for the tetany, and then I guess we monitor magnesium, potassium, calcium, and phosphate.
Mm-hmm.
And then also we have to check for chvastic and Chaso signs, since she's in tetany now for hypo.
Mm-hmm.
And then I'm going to start her on early ambulation to promote bone calcification.
Exactly.
Sounds good?
Okay. So
All
let me
right.
just bring you in there, and I will introduce you to the patient.
All right, beautiful. Thank you.
Hey, Jazmin, I just wanted to let you know that I'm going to be leaving for the day, and Khrystyna's going to be the nurse on shift, okay? If you have any problems, just let her know, all right? And I'll see you probably maybe tomorrow morning.
Have you heard anything from my doctor?
No, but he should be coming around at about 10 a.m., okay? That's usually when they do their rounds, okay?
Okay, thank
All right,
you.
have a good one.
All right, so as Corynne told you, I'm Khrystyna, and I'll be taking care of you today. How are you feeling?
So my neck has been hurting a lot, and I'm having a trouble time swallowing,
Mm-hmm.
and my body feels really, really stiff. Is that something normal? Because I'm getting really concerned.
All right, well, since you did just get out of surgery, we are monitoring you. We are checking your labs, so we're checking scans. All right, Jazmin, so let me just check her site. All right, everything looks good. Let's check how it's infused. All right, good. And then I don't know why you're up so high in bed, but we have to put you down, okay? I'm sorry. The doctor will be coming in around 10 for his rounds. You'll be one of his first patients since you are just post-op. And if you need anything, you have the call bell. Just let me know if I can offer any assistance to you, and I'll be right around the corner.
Okay, thank you.
Thank you, honey. Hey, Jazmin, how are you today?
I'm alright.
All right, a little better?
No.
No? Okay. Well, I did talk to your doctor, and he said that we're going to do 2 little small tests on you. We are going to be checking your signs. The first sign is called the chvastics.
Okay.
So I'm just going to tap on your...
Is it gonna hurt?
No pain. Don't worry. I won't hurt you.
Okay.
All right. And then the second one is going to be with a blood pressure cuff, okay?
Okay.
Give me 1 second. All right. So let's see your arm. No. We have the IV this side. All right. So then just hold your hand steady. You could hold it on your hand. Go ahead and inflate it a little bit. All right.
How long is this for?
This isn't going to be long. Just when I inflate it, I want to see what your hand will do, okay?
What's going on with my arm? What's going on with my hand?
All right, okay. Let me just deflate it for you. Can you move your fingers back?
I can't move it.
No, okay. Let me deflate your cup. All right, is it better now?
Yeah, that was so weird. Is that normal?
Okay, the doctor will come in and we'll get it checked out. Unfortunately, I'm just a nurse. I can't give you medical advice. So the doctor will be in shortly, okay?
Okay, thank you.
Hey, Corynne.
Hey, I'm good. How are you?
Good. Just long day overall. I mean, I guess Jazmin is worsening. What we thought was moderate tetany became severe. She's Travastic sign is positive. Tristate sound is positive. Calcium's dropped. We're giving her calcium IV all the time now. Still kind of irritable. Just a very hard patient to deal with, you know. So I guess there was, to my understanding, a mistake in a surgery.
Really?
Surgery, yes, because
What happened? How was it a mistake?
Well, you know the doctor. He likes to get friendly with the nurses, likes to go out. Well, we all went out the night before. I didn't know he was on call. Nobody knew. So he drank a little bit, then got friendly with some of us a little bit, and his wife showed up. And you know his wife, she gets very rowdy.
Oh my gosh.
So she took him out. We were left alone, drunk and alone.
What time was that?
Around like 4:35.
And he had surgery 2 hours later?
Yep. 2 hours later.
So what did he do? What was the mistake?
From what he told me, we were talking about it, he might have cut off the vascular supply to the other 2 parathyroid glands. So
now the patient has no acting parathyroid glands.
So all the calcium she's going to be receiving is going to be through supplements.
Oh my gosh.
Yeah.
Shouldn't drink and be a doctor.
So hot but so dumb.
Hello. So if this were to happen, because there are no longer any parathyroid glands, patient has to regulate their own calcium levels. And they're going to do this by multiple calcium supplements a day, increased calcium diet, vitamin D supplements, and 3 to 4 visits to the doctor to check their calcium levels a year.
Hello, I'm Khrystyna, and this is Corynne and Jazmin.
And we're here to talk about parathyroid glands.
Oh my god!
Hormone or the
So what are some problems that can happen if our parathyroid...
Blooper.
So we're about to begin. Enjoy.
Say all those other things.
Keep going. Keep going.
I just said I don't fucking know. I don't think
Why would you say
I'm
that?
trying to get into it.
Alright, so I'll see you.
Why did you laugh?
The whole thing has to be done. I'm gonna disconnect it from when I leave.
Anything. Anything. Anything.
Hey Jazmin, I just want to let you know that I'm gonna be leaving for this.
This is.
Hey Jazmin, I just want to let you know I'm gonna be leaving for the day, and Khrystyna's gonna be your nurse. So, I'm
Don't leave, Corynne!
Stop.
Don't leave!
I'm trying. Give me some fucking
You really shouldn't be grabbing your nurse like that.
Excuse me. Excuse me. I just heard you say that the doctor messed up. What's going on? Can you guys tell me what's going on?
No, Jazmin.
I don't feel
No,
well.
go back to sleep.
Hi. So, as you guys heard, what happened? Dr. It's awkward.
Arm? No. We have the IV this time.
Let's do this.
Hey Khrystyna, I'm gonna be leaving for the day.